Well, it is officially fall, 8:14 now on this September 25th. September 25th, yeah, that's right. But it's not the time to fall. More than 1 in 4 adults fall each year. Luckily, research shows that our fall risk isn't entirely outside of our control. In honor of National Falls Prevention Awareness Month, Dr. Brent Wallis, Chief Medical Officer at People's Health, joins us to share tips for staying steady on your feet and not tipping over. How you doing, Dr. B?
Hey, Tommy, I'm doing great. How about you?
I am well, sir. Thank you. Tell me why fall prevention is so important.
Yeah, this is really critical because it affects so many people, and what it is really is as we age, your chance of falling down is more likely, and so what happens when you get older, you can lose a little bit of bone density and some muscle mass, especially in your core muscles, and that can make it easier for you to either fall down or, if you do fall, to break a bone. And the other thing is, as we get older, our eyesight and our hearing can decrease. Our reflexes may be a little less sharp than they were when we were younger. So you might have trouble avoiding obstacles or pivoting when you're walking, and so falls can be more likely from that. And then the falls, as you get older, themselves become more dangerous. You know, like I mentioned, the bone density decreases. So if you fall, you're more likely to actually break something or have a more serious injury that may make you have difficulty staying independent.
Anything else that can kind of increase your risk of falls?
Yeah, the other thing to keep in mind is medications can actually increase your risk as well. And these medications are important to treat a lot of those chronic diseases, but a lot of them affect maybe your brain or your blood pressure or your blood sugar as intended, but they can have side effects, things like some tiredness or dizziness or even confusion. And so you have to be real careful with those medicines, and if you're having those side effects, talk to your doctor. You know, the other thing is certain health conditions people develop as they get older can cause problems, things like foot injuries, balance problems, that weakness I was talking about, especially in the lower extremities, can increase your risk for falls. And then something really common is called neuropathy. Neuropathy is a problem we see in a lot of diabetics where it affects the nerves in the legs and the feet. It may make your feet feel numb, so you don't know exactly where you're placing them, and you may misstep and then fall down.
Best thing, of course, to prevent a fall. What are some ways to prevent the risk of falling or lower it?
Yeah, I mean, there's a lot of things you can do. Kind of the first thing to start with is make sure you're taking care of your health overall. You want to make sure you're seeing your primary care doctor. You want to work with them to create an exercise routine, because exercise is really critical to reducing falls and reducing your risk of a severe injury from a fall. They can help you, learn exercises to help strengthen your muscles, maybe improve your balance. Things like water workouts, walking, Tai Chi are great options. But even something simple you can do in your home, like standing on one leg or walking heel to toe, can help improve that balance, which is so critical. And then, in general, just stay up to date on all your medical care. It's really important to manage all your health conditions, including things like vision, because glaucoma in particular, or cataracts, can cause vision problems that can lead to falls. And then, of course, type 2 diabetes, which can cause neuropathy and low blood sugar. That's another one that's a high risk.
As you talk about doing those things, Doc, standing on one leg, et cetera, I think people need to realize you're not doing it to get in shape, and you can't look at it as, what kind of shape am I going to get in standing on one leg? The idea is to keep your legs, to keep your balance, to make sure that you can still walk without falling, right? That's the goal.
Exactly. You're not going to bulk up or anything from that,
right,
but actually kind of training your body to know how to adjust and make sure you stay balanced is really a critical skill you can lose as you get older.
And for people that don't think there are benefits from that, there certainly are benefits to that. What else can you do?
Yeah, so another thing is if you feel like you need, or your doctor says you need, a cane or a walker, use it. Don't feel bad about it. It's really critical because that may be the piece of equipment that keeps you from falling down. And then a lot of people, as we get older, we tend to feel colder, so people may wear socks, especially as the weather gets cooler. Be very careful with socks on hardwood floors. They do make some with little grippers on the bottom that can help you, lower your risk of falling. And then avoid really baggy clothing, baggy shirts and pants, because they can actually get tangled up or they can get caught on something and result in a fall. And then another really big one is if you have pets, be very careful about how they may affect your fall risk. Cats and dogs can get up under your feet. They can bump into you. So you've got to make sure that they don't jump on you, that they're not walking in front of you, and certainly that they don't pull on the leash, which can be difficult. That can actually pull you down.
I had a dog one time, I swear, was trying to cut block me at the knees, or try to walk on my slippers as I was walking on them. So you do have to be careful about that. We'll talk about fall-proofing your home when we come back. We're talking with Dr. Brent Wallis, Chief Medical Officer at People's Health, about fall prevention and how important it can be to make sure that you take care of your overall health. 8:20, traffic now, WWL. All right, 8:26 and a half. Tommy Tucker, WWL, back with our guest, Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health. We're talking about fall prevention. It's Falls Prevention Awareness Month now that we are into fall. Can you fall-proof your home, Doc?
Yeah, you definitely can make some adjustments, and you really should think about doing this because more than half of all the falls actually happen in the home. So, there's some easy things you can do. Try to keep your floors clutter-free. Because you're more likely to trip over something if it's laying in the middle of the floor. And, make sure you don't have any loose cables running all over the place. You might trip on that. And then rugs are really important. You need to make sure if they're on a hardwood floor that they've got skid-proof backing so that they don't slip and then you fall down. And then watch the edges of them. They tend to curl up, and that can create a hazard as well. And then the other thing a lot of people don't think about, but lighting is really critical. You need to make sure that your home is really well lit because you don't want to run into something you didn't intend to. So change those light bulbs, especially around stairways, because that's a really dangerous spot in your house.
And turn them on as it starts to get darker earlier. What else can we do to stay safer on stairs, Doc?
Yeah, so stairs are one of the most dangerous places, and because you're going up and down, you must have handrails, and you need to make sure they're sturdy because if you do become unstable, you want to be able to grab onto something. And if you've got wooden stairs, you probably want to think about adding a runner or little carpet squares because that'll help a little bit with the slipperiness. And don't carry things up and down the stairs if you can avoid it, especially heavy or large items, because they're going to block your vision and you're more likely to fall that way.
How can we make kitchens safer?
Yeah, kitchens, a couple of things you can do is make sure the common stuff you use, dishware and ingredients and stuff, are well within reach. You don't want to have to go up high in a cabinet. You don't want to get on a step stool. You want to use a grabber tool or just keep it somewhere where it's easier to reach. And then be really careful in the kitchen because we use a lot of soap and cooking oils and water. And if that gets on the floors, it can make them slippery. You want to make sure you clean those up right away because that's an area where you could slip and fall.
Speaking of soap and slippery, got to talk about the bathroom.
Yeah, the bathroom is the most common place for falls, and obviously it's because it does have those wet, slippery surfaces. And so you want to do things like add a non-slip mat into your shower area or your tub area. That's going to help a little bit. You may want to actually install grab bars in the shower so you can get in and out easily. Or if you've got a lot of lower extremity weakness, you can also get a shower chair, and that's something so you're not standing up in the bathroom. But be very careful, especially at night. If people get up and go to the bathroom, it's going to be dark. You might actually have an accident.
If you do fall, what should you do?
Yeah, really, falls are definitely going to happen. So the most important thing is make sure you get whatever medical care you need after you have a fall. And it's really important after that urgent care is obtained, you want to make sure you talk to your primary care provider because they can help you try to figure out either why you fell or what you can do to prevent that fall. But they'll also check you for injuries you don't realize you might have. So it's really critical to have that follow-up appointment as well.
Any final advice, Doc?
Yeah, the only thing I would say is a lot of people fall and then they stop doing what they like to do, and that's actually the worst thing you could do. You want to try to stay active. If you become inactive, you're more likely to exacerbate the problem with that muscle weakness. Don't be scared. It's okay to be a little bit worried, but try to stay active, maintain your strength and agility and everything, and that's going to keep you on your feet.
Again, you're not training for the Olympics. You're just trying to maintain your strength, agility, and balance. Valuable information. Thank you, Doctor.
Thanks, Tommy. Talk to you soon.
You bet. Dr. Brent Wallis, Chief Medical Officer of People's Health. You can find out more about People's Health if you visit the People's Health Medicare Center. That's in Metairie, 3017 Vets. It's located between North Causeway and Trader Joe's. Appointments are recommended, but walk-ins are welcome. You can also go to the website, peopleshealth.com, or call 1-800-978-9765. And I think that open enrollment period is approaching. So peopleshealth.com, everything you need to know right now. Time for WWL First News.